So lithium is a medication that is commonly prescribed for bipolar disorder. And lithium, sometimes combined with things like antipsychotics or antidepressives, generally do help to balance out the mood swings, right? The problem with lithium is it is, as I said, commonly prescribed, but it is a dangerous medication to the extent that toxicity in the bloodstream is something that is a potential side effect, and it's fairly common. So when someone is prescribed lithium by a psychiatrist, they generally are monitored through blood work, and they have to keep a very close eye on how the blood levels of lithium are in the bloodstream, because if it gets too high, it can be very serious. The side effects can include diarrhea and vomiting and some very bad things. So it's a particularly toxic medication if it's not monitored properly. So because of that, usually, at least at first, when it's prescribed, blood work is done quite often, right? So that's treatment of bipolar disorder. Um, there is another type of mood disorder that we want to talk about, and that's dysthymia, right? Dysthymia is different because it's really considered a low-level chronic depression that happens over at least a 2-year period of time. Now, this sounds like a long period of time, but it's not marked by depressive moods where the person can't get out of bed or can't function. It's more of a low-level depression where you just don't feel as happy. You wouldn't report yourself as happy, but it wouldn't be a depression where you're unable to function. So dysthymia is diagnosed between 6 and 8% of the population, and again, it's a decent chunk of the population will carry this. Um, what are some of the causes of the mood disorders? Well, we know there's genetic factors that are involved, right? We know that there's genetic factors because there is a chemical imbalance that is present, right? And we know that in families, that is to say, if you have family members that are in your direct family tree that have had a mood disorder, it does make you genetically more predisposed to getting that type of disorder as a descendant of that family line, right? So if your parents both had mood disorders, you'd be more likely than someone in the general population, far more likely to get a mood disorder. So we know that there are genetic factors involved. What about psychosocial factors? So personality traits, certain personality traits, the way you handle stressful situations, whether you're a type A, those things can contribute to mood disorders. And the ability you have to cope and deal with stressors plays a large part in whether or not you develop mood disorders and how severe they become. So part of the treatment for mood disorders then becomes, of course, as we mentioned, biochemical treatment where the psychiatrists will prescribe antidepressants, they'll prescribe lithium, they'll prescribe some other types of antidepressants, and maybe some antipsychotics if there's thought disorder mixed in with bipolar or with the mood disorders, right? So a lot of times the treatment includes, like I said, either Prozac or Zoloft, one of the SSRIs, and these do have some side effects, and that's why you really do have to monitor those side effects as people take them, because they do potentially have some side effects. Also, as part of the treatment for mood disorders, usually there's some form of psychotherapy, especially for less severe cases of it, right? So, as I pointed out with bipolar disorder, you can have like a mild case, you can have a very severe case. Same thing with all the mood disorders. And it turns out that when they do large-scale studies on treatments, any form of psychotherapy can be just as effective especially in milder cases, as medications can be. Right. So, and of course, that's less invasive, and you're less likely to have side effects from psychosocial treatments, right, such as therapy. So, a lot of times, cognitive behavioral therapy can be effective because this can help to change your thought processing. Sometimes insight-oriented or psychodynamic psychotherapy can be helpful to learn the causes of where your mood disorder comes from. So and usually when people treat mood disorders, they recommend a combination, right? So usually you have some form of psychotherapy that takes place, some form of talk therapy, And also, along with that, you have the prescription of psychopharmacology, right? So that's the most common modes of treatment for that. There's another form of treatment that is available, which is ECT, or electroconvulsive therapy, right? And that is an option, usually considered a last resort option, although in some cases people have responded even if it's not a last resort. Um, this includes inducing seizures, and usually recommended between 10 and 15 sessions of that to start with. And it does lead to some short-term memory loss, but as far as long-term side effects, not too severe. And in some cases, this can be something that's very helpful to sort of jumpstart. Why does ECT work as far as how it brings people out of depression? We don't know that at this point in time. All we know is they make the analogy of sort of hitting the reset button on your computer, right? So it seems to reset things, neural pathways, and because of that, sometimes the chemical imbalance is addressed in your brain. So there is another form of therapy which also is taking hold, which is the use of psychoactive medications in dealing with mood disorders. Ketamine is used for that type of disorder. Those type of psychoactive medications are being considered in the future for treatment of different types of mood disorders, right? All right, let's talk a little bit about personality disorders now. Personality disorders are extremely difficult disorders to treat. Part of the reason for that is because they're not particularly responsive to medications, right? So let's start with talking about a borderline personality, right? Borderline personality, what relates to that is intense, unpredictable emotional outburst, right? So it's mood dysregulation where someone has an inability to regulate their moods in a normal manner, right? They generally tend to lack impulse control, and they are dangerous in the sense that they exhibit dangerous behaviors and oftentimes dangerous expression of their anger. So this can include cutting, self-injurious headbanging, things along those lines are very common, unfortunately, in a personality disorder. And again, this particular population where you have personality disorders, they're not particularly well treated with medication. Sometimes their symptoms respond to it, but overall, personality disorders respond generally better to talking types of therapy. The problem is you have to get them involved in it, and that is a challenge with someone who has a personality disorder because oftentimes they don't think they have a problem. Right? So DBT, or dialectical behavioral therapy, is one of the most effective ways of treating someone with any type of personality disorder. And what that involves is we acknowledge that they do not have their own conscience that guides their behavior. So they are taught in group settings and individual settings to use the judgment of others so that they know how to relate better to people. And in this way, persons with a personality disorder learn to function in a more sociologically appropriate manner, right? So personality disorders are not limited to borderline personality. You also have an oppositional defiant disorder where basically the person just is disagreeable in order to be argumentative and opposes anything that's sort of an organized thing in their life or any form of authority where that tries to have influence, right? So, and of course you have the narcissistic personality disorder. And in a narcissistic personality disorder, that is someone who sees things only from their own point of view. They don't care about the welfare or good of others. They're basically just concerned with how things affect them. And because they are not able to see things from another person's point of view, they become the height of egocentricity, not caring about the consequences as they lay out for other people, but only caring about how the consequences of behaviors play out for them. Okay, so that's some of the personality disorders I wanted to go over with you. Now I would like to spend some time talking about schizophrenia, right? So over at Pilgrim across the street, we have been treating schizophrenics for many, many years, and treatments for schizophrenia have really changed quite dramatically over the years. Back in the day, before the advent of psychotropic medications, you saw mostly warehousing of people. They were isolated. Many times they had to be restrained and put into um, things that would hold them physically in order to control what we could call psychotic behaviors or schizophrenic behaviors. And then we went through a period of time where lobotomies were popular in the 50s. If you look up lobotomies and watch the YouTube presentations, there are actually YouTube films on Pilgrim Psychiatric Center giving patients lobotomies and how that came about and what the result of the lobotomies were. So that was considered an acceptable treatment at the time, but turned out not very humane. In fact, the gentleman who developed the lobotomy treatment actually ended up winning a Nobel Prize for it because at the time it was considered such a breakthrough because it did allow people to function in a calmer manner. Unfortunately, when it became accepted as a cure-all for a lot of different psychiatric disorders, it wasn't considered very humane because you ended up severing the connections in the brain that allowed people to have emotions. And so people complained about the fact that they couldn't feel anything following the treatment. Yes, they were calmer, but didn't have any sort of feelings. Anyway, then with the advent of psychotropic medications in the early 60s, that's when you really started to get change in how we addressed all of the psychiatric disorders, but particularly schizophrenia, right? So what is schizophrenia? Schizophrenia is a devastating mental disorder. It lasts at least 6 months, and literally it's translated as a split from self, okay? It's a disconnection from reality. It involves serious symptoms which interfere with a person's day-to-day functioning. So the amount of functioning